Good afternoon. My name is Gerard Migeon. I'm the CEO of Natural Womanhood. Natural Womanhood is a nonprofit organization that we started because there is a need for promotion of fertility awareness-based methods. We want to change, first of all, the perception that hormonal contraceptives are the only option to plan a pregnancy, and the other perception that we want to change is that natural methods are ineffective. And so we invite all of you who are listening to today to go to our website, naturalwomanhood.org, if you'd like to learn more. Now, back in March, I was contacted by a group of physicians in Nigeria called Doctor Health Initiatives, and because they were interested in our documentary. And my correspondence with them was quite an eye-opener. Because I discovered that actually there were a lot of problems, and because of the very strong, to say the least, a very strong promotion of hormonal contraceptives in Nigeria and everywhere in Africa. And so I wrote an article about it, and a few days later I received an email from Dr. Muclaire-Jones, who is our guest today. Now I want to just say a few words about him before I invite him to tell us more. But Dr. Muclaire-Jones is a family doctor in Butte, Montana. In French I would say Butte, but it's in Butte, Montana, with more than, and Dr. Muclaire-Jones has more than 30 years experience of practicing medicine. He's a family physician, and he completed his medical school at the University of Washington, followed by an internship at Deaconess Medical Center in Spokane, and a residency at St. John's East Side Hospital. Also, Dr. Muclaire-Jones, and that's why we started talking, because he heads a nonprofit called Maternal Life International, which works to improve maternal and family health in underserved parts of the world, and especially in Africa. So I'm very excited and welcome you, Dr. Muclaire-Jones, today. Thank you for joining us. And could you, would you add a little more about this this background experience? 30 years of practicing medicine, and I understand 30 years of actually working in Africa.
Oh, thank you very much, Gerard, and thank you for all the work that Natural Womanhood is doing and the advocacy you're bringing. It's so greatly needed. As you said, my background is in family medicine, and I also did a fellowship in obstetrics. So most of my practice in the United States is family medicine and at least half of it obstetrics. So these are real issues to me. And I was privileged to first go to Africa in 1985 with a group called Mission Doctors Association, and I worked in Cameroon in West Africa for a couple of years. And then for a period of time was busy with raising a family and establishing my own practice in the United States. And then eventually I went back, and mainly the focus was obstetrical care and reducing maternal deaths. And then we also became involved with our nonprofit in HIV care. We started the first ever parish nurse program to take care of AIDS patients through home-based care, which was very successful in Swaziland and South Africa. And also, one of the things I realized at that time is the same thing that prevented AIDS was faithful, chaste, and self-giving love was the same foundation of natural family planning. And so we began advocating and teaching natural family planning. One of the things that we realized is that some of the methods were too complicated, sometimes for patients here and also in Africa, where someone might be illiterate. They've never had the opportunity to go to school. And so we worked to develop a simplified method of natural family planning. But I've continued to have my heart in Africa. Our nonprofit has affiliates in Uganda, Tanzania. We work with another group that has an affiliate in the Diocese of Ida in Nigeria. We also have an affiliate in Haiti. And all of them have great experience and great success in using natural family planning.
So what prompted you to start MLI?
Well, I must say that when I went to Cameroon, I had never seen in the United States a woman die in childbirth. And when I saw that, a woman coming in, she had had severe toxemia, multiple seizures. She came in, she was brain dead, she was swollen. That profoundly affected me. I saw women bleed to death from postpartum hemorrhage, women who died from infection, from obstructed labor. And those kind of things always haunted me. And after I'd been back for several years, I got a letter, and the letter said, the month of February was very sad. 2 women died in childbirth. And this was a very small health center in remote Cameroon. And that night I just said, I got to do something. And that's when we started MLI. That was back in 1995.
So what you have, MLI is promoting natural family planning and promoting method. You have other activities, right, as well?
Right. One of our most successful programs has been a program called the Faithful House that we developed with Catholic Relief Services. And what it was is to first help couples to renew and rebuild their marriage. And they used the metaphor of building a simple African house. And it was shown to be very successful, not only in preventing HIV in married couples, because once their marriage was together, they didn't go outside their marriage and contract AIDS. We also found it did many other things. It helped lift couples out of poverty, it reduced domestic violence, alcoholism, and so forth. We also found that it really formed the foundation for natural family planning. Because once a couple was working together, then they wanted to practice NFP. And we also saw many of them that had side effects from hormonal-based contraception.
So let's talk a little bit about contraception in Africa, and information I found out when I started looking at what was going on in Nigeria is that the campaign, they had very, very ambitious goals to grow the usage of such contraceptives, hormonal contraception, and where actually the rates I read about in their plan was to go from 30 to 16% to I think 36% in the space of 6 years in Nigeria in terms of percentage of use by women, which is a very, very radical growth. Can you tell us a little bit what you've seen in the countries you've been working with in terms of usage of contraceptives and how that have been affecting the population there?
Sure. I think one of the great tragedies is that there was so much emphasis by international bodies on reproductive health, which basically meant prevention of pregnancies through contraception, abortion, yet they ignored the real needs of women and families. So, for example, ignoring the need for essential obstetrical care that saves the lives of mothers and babies. So in that context, as you know, there's tremendous pressure on these governments to accept contraception. And it has its dangers. One of the great things which is still not really acknowledged is that in many parts of Africa, especially the South Africa, HIV has been facilitated by Depo-Provera. Depo-Provera increases the risk of HIV transmission by probably 2 to 2.5 times, and that's a tragedy. So I think that there's a lot of imperatives, a lot of reasons why we need to offer women and couples natural family planning, and it's very consistent with their culture. Their culture is pro-life, it's pro-children. If women have side effects, it's not like they can run to their local family planning clinic. They're dealing with the irregular bleeding, the nausea, the side effects in their village. And so I think that it's just a shame that natural family planning has not been promoted, and there's been so much pressure on countries to accept artificial contraception.
So do you already, in your more recent visit, have you been already able to observe some of the effects of the contraceptive push among your patients or families there?
Sure. Certainly it's It's all over. You can ride a bus and you see billboards. You see posters on the highways. You have in Uganda, you have trucks sponsored by USAID that are coming to villages to distribute contraceptives. So it's again, tremendous pressure. And in our Faithful House program, where you get couples talking together, they're rebuilding their marriage. They're talking about issues like sex and sexuality that have been taboo. And one of the things that comes up is, oh yes, I've been to the family planning clinic, and oh yes, I'm having side effects, or my sex drive is diminished because of that. And those kind of things have profound effect on the couple and on the family.
Yeah. Are there, like, here there's already not enough education about the side effects and risks because of our systems. Who gives the contraceptives in these countries, and are they trained to really explain the risk and side effects?
No, this is a this is in and out. Their job is on those family planning clinics is to get women in and out within 5 minutes. Come in, get your shot of Depo-Provera, you're out. Take your pills, you're out. So there really is little education, and there certainly is little opportunity for them to be taught natural family planning. It's just simply not a priority.
Oh yeah, yeah. Well, I hear from our partners in Lagos that this example of this young woman who had a child, and right away at the hospital they gave her the pill, even tell her anything. That's that's, you need to take this pill, and she was able to recognize that it was a contraceptives, and she said, no, I don't want this. I want to learn a fertility awareness method. I think she was talking about the cycle beat at the time, and no, we don't do that. You can't have that. You need to take this. And she was taken to 4 different clinics, to really. I mean, it was the pressure seems to be amazing, and if a woman is informed and strong enough that she knows, okay, no, I don't want this. I know there are risks. She might be able to resist, but I imagine most women will not have that information.
Sure. If they haven't been introduced to natural family planning, or they're going to go with generally what the healthcare provider says. They assume the healthcare professional knows what's best for them, and again, they're not given the alternative of natural family planning. And there's some things too, like there's some studies that show that combined birth control with pill that has estrogen could decrease the milk supply, and that's a terrible thing, because breastfeeding is so important for the health in resource-limited countries. Anything that diminishes breastfeeding duration or effectiveness has a great effect on children's health.
Right.
And so I think we've got to do better. We have a better alternative. I mean, the fundamental assumption of artificial contraception is there's something wrong with a woman's body.
Right. Right.
And these hormones are going to fix it. Well, there's not. A woman's body is made beautifully, and our job is to educate women and couples about that body and how to work with it and not against it.
Yeah. Now, I mean, some of our audience could probably say, there's already so much work in the U.S. to do about that, and education, and that, that's why we exist. There is indeed a lot of work to raise awareness about the dangers of contraceptives and the benefits of natural family planning. But why would we care about even Africa and what's happening? And why is it important, in your opinion, that we should also invest in Africa and help them?
Yeah, I think there's an opportunity for preserving in Africa something that we've lost in the United States and Europe. Kierkegaard had a saying, the trouble with life is you live it forwards and you understand it backwards. And now when we look back and we try to understand the effects of contraception, it's had tremendous negative effects on our culture. So let's help Africa not make those same mistakes. Let's give them this beautiful option of natural family planning. And maybe they will save themselves from some of the same mistakes that we've made, that they will preserve a culture of life which has slipped away from us.
Mm. So let's talk a little bit about the method, and you mentioned that you felt like we needed a more simpler method for the population in Africa. Can you describe your method and how it works?
Sure. And first of all, I'd say way by context is I think we need simplified methods here as well. Mm-hmm. And my experience in Africa is many times my colleagues there are better educated than I am and mm-hmm. have greater knowledge about many things. So in many ways, in fact I call our team who's heads up Maternal Life Uganda, I call them my professors because they teach me a lot. So again, but we need to make natural family planning simple as well as effective. So we've worked, and we recently had an article published about a method we developed called couple bead. And couple has a double meaning. First of all, we invite the couple. We want the man to work with the woman, husband work with the wife. So it's a shared method. It's just not simply the responsibility of the women. So that's the first meaning of the word couple. And the second thing is that we bring together two signs of fertility. The first sign is the cycle day. So we know that days at the beginning of the cycle and the end of the cycle are much less fertile than days in the middle of the cycle. So we've kind of coded those cycle days on a string, which I'm going to hold up now. And you can see, hopefully, that
a little higher.
A little bit higher.
There you go, yep.
And if I go this way, you can see we start, there's a, oops, I'm going the wrong way. I'll go the other way here. As we start, there's a red bead indicating when a woman's period starts. And then we have brown beads, which indicate low fertility, yellow beads, which indicate increasing fertility, green beads, high fertility, yellow beads, again, with fertility decreasing, and then brown beads at the end of the cycle. So these are coded, and they're based upon new studies based on ultrasound determinants of gestational age. I'm not going to go into the details of that. So basically, any woman, any couple can count. Here's day 1, here's days 2, here's days 3. So the cycle days create the background for fertility. And then as you'll see, there's a little safety pin attached to each cycle day. And on that safety pin, they can place a bead which reflects a woman's observation of her cervical mucus. So if she observes bleeding, she puts a red bead. If she's dry, she puts on a brown bead. If she has egg white mucus, a green bead, so forth. So in a sense, that observation informs. It's an advisor for some of these days to know if the day is fertile or not. So you see we couple cycle days, simply counting, with the vulvar observations, the observations of cervical mucus. So that's a string that we use for regular cycles. Now, one of the things that is most challenging in natural family planning, and any natural family planning teacher will tell you, is what do we do about women with irregular cycles? What do we do about the transition from when a woman is breastfeeding and resumes regular cycles? Because while she's breastfeeding, she may not have a period for some months. And so we have a second string, and I'm going to hold that up here. And if you see that, you see it has no colors. Mm-hmm. That is because a woman may not have cycles. She may be breastfeeding a 7-month-old infant and is not having periods. So how does she manage her natural family planning? And she just uses the cervical mucus observations, and it goes on that string. And again, we make a comparison. We say, like, women have 2 sets of clothes. They have a set of clothes that they wear to work or every day, their regular cycle, and there's times when they have a different set of clothes, and they have to use a different circumstance where they use the irregular cycles. Okay. So that's a very quick version.
Sure.
Of what we do.
Great. And so you had already the opportunity to do some testing in terms of effectiveness, and how can you tell us a little bit about the research behind it? And
Sure. Well, in terms of research, we've been very fortunate. We've had advice, and the co-author of the article that I wrote on the couple B methods was Dr. Richard Faring at Marquette University, who I really think is one of the world's leading researchers on NFP.
Sure.
And his advice was tremendous in assembling this. So we really have, we think, a very solid scientific method. But as you know, to do research takes money.
Yeah, yeah.
And very few organizations are willing to fund NFP research.
Right.
They would much rather fund artificial contraception.
Yeah.
So we hope to get the funding to do some prospective studies on this.
Okay. Okay. Good. Good. But it's been, I mean, you have been using it for now a number of years in Africa, or I mean anywhere in the world, really.
Absolutely. So we've had a lot of experience. We've had a lot of experience in Haiti, where we have where they use it, and we've actually modified the beads a couple of different times, and we modify them in response to experience on the ground, new studies. But we've benefited greatly from a woman named Mary Finnegan from Archdiocese of Boston, who teaches NFP, and she's helped us in Haiti. And again, in Nigeria, we've had great success with Sister Kelechi, who you're working with now, and with our affiliates in Uganda and Tanzania.
Yep.
So again, we've really had great experience. We've just never had the money to do the kind of research.
Yeah, yeah. So hopefully that will come. But and just to mention that, so following the discussions with the group Dr. Health Initiative, so we were able to raise some funding, and some of our audience who helped us with that, and we're really grateful. But we had enough fund to get already some funding to do the training, and five teachers now of DHI have been trained by Sister Kelechi and are ready to go. So that's very, very exciting to know. Can you what is your vision? What, in your opinion, can help more people knowing and being trained about natural family planning and fertility awareness in Africa? What would be your suggestion, and how can people help?
Yeah, I would say that one of the things is, the way I look at it is almost as fertility literacy. Just as it's so important for women to know how to read and write, and how that empowers them, for couples to be fertility literate, to know about their body, I think is something that is a right. And unfortunately, with artificial contraception, that right is never realized. They're brought in, they're given injections, they're handed pills. They never learn about their body. They never learn about their fertility and sexuality. And I think that's a profound tragedy for women and couples. So we need to change the paradigm. And what you're doing, what Sister Kelechi's doing, so forth in Nigeria is part of that, changing the paradigm. And it's not easy. John Paul II said real love is demanding. So it does. It demands some education. It demands some resources. But once it's learned, it's a tool, a skill, a way of life a couple has for so many years.
Yeah, yeah, absolutely. And you're about to go to Uganda on August 2nd. But can you tell us a little bit about that trip?
Yes. So we're privileged. We have a wonderful affiliate there called Maternal Life Uganda. We're building a regional training center called St. Joseph's Family Life Center. If you go to our website, www.mlionline.org, you can see some pictures of that. And we're doing training in actually 4 different programs. One is reducing maternal deaths by better treating postpartum hemorrhage, which is responsible for 41% of deaths in Uganda. Teaching a program on infant resuscitation called Helping Babies Breathe. And we have an ultrasonographer teaching 6 midwives basic ultrasound. and then I'll be doing an update in the couple bead method, and again working with the teams that we have that teach the Faithful House program. Mm-hmm. That is so key. The Faithful House program, once those couples are formed, then that's when we bring in natural family planning. So we'll be working with them as well. So we got a busy schedule there. We also have some youth coming that are doing some work with children in orphanages and so forth.
Wow, that sounds like a very exciting trip. So, well, best wishes for it. Again, thank you very, very much for joining us today, Dr. Muclaire-Jones, and for all the work you do. Again, your website is www.mlionline.org, right? And,
correct.
And we're excited to work together with you. Again, if you are want to know more about the work we're doing in Nigeria, you can look on our blog. I have a couple of articles there at naturalwomanhood.org, and if you're interested in supporting the work there, you can also find it on WonderWe, Wonder, W-O-N-D-E-R, we.com/NFP for Nigeria. So thank you for joining us today, and we will see you in about a month. Thank you, Doctor.
Thank you so much. Bye-bye.
Bye.